New York City's teachers union threatening to strike if the city doesn't up its safety measures. Further west in Oklahoma, a teacher putting the pencils and the lesson plans away after a lifetime on the job rather than risk her health. NBC News correspondent Anne Thompson shows us the real concerns about going back to the classroom across America.
Hey, Allison. Here in New York City, home to some 1.1 million students, classrooms are set to reopen in 3 weeks. But with the coronavirus raging in parts of the United States, some students, teachers and parents here and elsewhere don't think that going back into buildings is such a good idea.
This morning, a very real civics lesson. As teachers across the country protest for a safe return to the classroom.
This is not about not wanting to teach. I'm a teacher. That's what I do. It's about wanting everybody to be safe.
Many teachers and students are uneasy about going back to school with the coronavirus still unchecked. In Oklahoma, teacher Nancy Shively deciding the health risks aren't worth it. She's resigning after more than 40 years.
I love teaching, I love the kids, and I'm worried about them.
Even in Connecticut, where the positivity rate is under 1%, there's fear.
I can't go back to school because it is not a safe place for me or my family.
In New York City, teachers in the nation's largest school district now threatening a strike.
We have promised the teachers and the parents of New York City that we would stand and fight if we felt a school was unsafe. And that is a promise we are going to keep.
The union's safety demands include testing for the 750,000 students and adults expected to go back to school buildings September 10th. Mayor Bill de Blasio downplaying the strike threat.
They can play any games they want. It is not legal.
What do we do?
On the steps of the Massachusetts State House, teachers demanded an online start to the school year.
Would I give anything to go back into the building? Yes, but not at the expense of somebody getting hurt.
A recent poll commissioned by the Massachusetts Teachers Association found 90% of parents were concerned their children could catch the virus if schools opened as scheduled.
What can quell those fears?
When the state can actually prove that the buildings are safe to return to, we have rapid and regular testing, and when the virus is fully under control in the state.
Now, adding to those concerns, a new study from Massachusetts General Hospital showing that kids can be silent spreaders of the virus. Of 192 children, 49 tested positive for COVID. And in those children, investigators found higher levels of the virus in their airways than in the airways of adults in intensive care. Allison?
Kids may play a larger role in the community spread of COVID. The evidence is growing. According to a new study out today from Mass General Hospital for Kids, NBC News medical contributor Dr. Natalie Azar joins me now. Dr. Azar, what does this new study tell us about kids as potential silent spreaders?
So, Allison, I think for this study in particular, it's important to talk about what the study is able to tell us and what the study is not able to tell us. And just in brief, what it's basically telling us is about the extent of infection, but it's not really able to tell us how readily children can actually transmit the virus, which is why some experts have, questioned and said maybe the title of the article was a little bit, or the study was a little bit misleading. So they tracked close to 200 kids who had symptoms and were presenting to a hospital or to a doctor. And they found that 28% of those kids tested positive, and they had viral loads that were very much similar to adult hospitalized patients. But importantly, up to 77% of those kids, the researchers believe, were actually exposed from their parents, so not child-to-child transmission. But what some experts have said, when they've analyzed this data is that, well, how can you really extrapolate that to the community? Again, these were kids who were symptomatic and sick enough to present to the hospital. And we also don't know if it means that the children are necessarily spreading the disease more readily just because they had high viral loads in their nasal swabs.
So, Dr. Azar, what should parents take away from this study? What should they be gleaning from all we know so far about COVID in kids as they consider sending their kids back to school this fall?
Well, you know what, Allison, I feel like this is, we have we're every single day or every single week, we're getting more and more information about this. And, this is just adding to the total. I would say for parents at this point, a lot of experts have said, you can basically split the conversation of school into two different cohorts. You have perhaps elementary and grade school children who, while they may have a high amount of virus in their nasopharynx, they may not spread as readily, right? And that was the whole point of this article, was that they made that that leap, that judgment without necessarily having that data, as opposed to older children who we know can transmit as readily as adults. And so I think the overwhelming thing to tell parents, and I'm telling this to myself as well, is you have to think about the rate of community transmission in your area. And if that is high, you need to really, really think twice about allowing your children to go back to school. It's really that simple. Many schools and many school districts, while they started with a hybrid model, have started to pull back and are going all remote. And I think that every family is different and should have options, because they may have family members at home, for example, who are at higher risk from getting very, very sick should they contract COVID.
We have seen, Dr. Azar, this virus break out in K through 12 schools, but some researchers say the federal government isn't necessarily tracking those outbreaks and some states are not reporting them. How can we fully understand how COVID-19 spreads and its impact on children without that data?
Yeah, and so this is really a concern that states have been citing privacy issues, relying on local officials to make the determination about reporting. And as far as this NBC report goes, there's a lot of inconsistencies, I should say, rather. There have been a lot of gaps. There's different definitions of outbreaks, and I think that's something that's a major concern. Is it greater than 5% transmission? Is it more than one classroom? There's not really a universal definition of what an outbreak is. And also, they haven't been specifying the school or the district, which I think is really difficult for especially, parents in terms of decision making. One thing that has been done is that researchers have been working with the School Superintendents Association to create a dashboard where they're actually documenting the number of cases, the total number of the student body, how many kids and teachers are actually in quarantine, and also the changes in the number of cases over time. It really boils down to, if you have a school district that's doing well, or you have a school district that's doing poorly, you want to know that information so that you can analyze what those schools did right and what the schools may have done wrong in order to move forward and learn.
Let's talk about the teachers for a moment. New York City school teachers are threatening to strike if students aren't universally tested before going back to school, among other things. Your advice for teachers across the country who are concerned about their safety and also their students?
You know what, Allison, my heart almost breaks every time I listen to teachers who say adamantly, I am a teacher. I want to be in the classroom. I miss my kids. I want to be there. They are protesting only because they are concerned for their well-being and for their families' well-being. Remember that while kids, for the most part, with some exceptions, tend to do better with COVID-19 than adults, the teachers who are teaching these students are not in that same situation. They do represent a large percentage of the population who does have underlying conditions and who are at greater risk. So unfortunately, I feel like in this situation, if you are a teacher, you need to take care of yourself. You need to protect yourself. You need to either, whatever it is, whether it's you go to your union, you come to your doctor and ask for, a letter of exemption, whatever you need to do to protect your health, you need to do.
Dr. Azar, a big picture question for you. We're seeing new daily coronavirus cases coming down a bit. In your medical opinion, is that a positive sign, a good read on where the coronavirus is heading? Or is there something else going on here that may be creating those kinds of numbers?
You know, Allison, I mean, at some point, the amount of, educating and reporting that we've been doing about the importance of masks and social distancing and the significant pullback in the South and West of reopening and closing bars and restaurants will have an effect at some point. Remember, the virus goes in a very predictable manner. People get sick. They get tested, they are hospitalized, and then unfortunately, some of those folks will die. So while we might be seeing a decrease in certain areas, make no mistake, the rates are still persistently high in much of the country. And we will start to see, we already have been seeing double the average of deaths now than we saw in early July. So we're hoping that with the decreased number of cases that we're seeing now, towards the end of August, early September, I hope to see the mortality data improve. Yesterday, I think we had greater than 1,000 cases or greater than 1,000 deaths in the U.S. again, which has been the average over the last 2 weeks.
And as you said, the numbers still so concerning. Dr. Azar, thank you so much. It's always wonderful to have you on. Thank you for your advice and your expertise always. We appreciate it. College students in Florida are moving into their dorms with some strict new coronavirus rules. But even so, administrators say they might not be able to avoid coronavirus clusters. NBC News correspondent Sam Brock is in Boca Raton.
Allison, good afternoon. I'm on the campus right now of Florida Atlantic University. It is one of several move-in days for students here. What you're seeing right now are the hallmarks of what's a typical start to the college season when it comes to parents coming in, bringing in loads of bags, moving into the dorms, goodbye hugs. But this is anything but a normal day. Right now, this university taking several steps at this moment to try to prevent any sort of start of COVID-19. What we know is they begin classes on Monday, 80% online instruction. And within the dorms themselves, you're looking over my shoulder right now, it's about 80% full of students, 3,500 or so. The classrooms are going to look a lot different. Only first floor class instruction. That's because they're trying to reduce the amount of time people are spending in elevators or cramped spaces. 25% capacity in terms of the classroom load as well. Just some of the steps they're taking here on the campus of Florida Atlantic. About an hour to my south, you have the University of Miami. Miami has 75 student ambassadors that are paid to go around campus and make sure people are wearing their masks, social distancing, and not violating any rules. We were lucky enough to be able to speak with the president of the University of Miami, Julio Frank. He talked a little bit about why it's so important that they control the atmosphere at the University of Miami.
When you see the images of partying going on in other parts of the country, are you worried that could happen in Miami?
Of course, I'm worried. We're going through a very strict disciplinary process, and we will sanction any student who violates the rule, because in this case, they're not just putting their own education and health at risk, but that of everybody else, including the vast majority of their classmates who really, really want to have a successful semester on campus.
So one of the challenges, Allison, is that you can control everything you want on campus in terms of testing, protocols, masks, sanitization. The difficulty becomes what happens off campus. And we know we've seen clusters of COVID breaking out at places like UNC and Michigan State and Notre Dame, where they've either had to stop in-person instruction or tell students not to come on campus at all. Many of those administrative officials are saying they're seeing the outbreaks and tracing them to off-campus events. That is the concern in Miami, Florida Atlantic University, really many of these colleges right now. They are preaching to students, be smart about what you do, because that will have an impact not just on your personal health and safety, but the ability of the student body to actually get an education on campus this year. It's the very latest in Boca Raton. Sam Brock, NBC News.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.